RSV cases keep climbing across the valley, and the number of children and babies getting sick, it's causing valley hospitals to get close to or at capacity for pediatric patients. One ICU doctor at UMC Children's says parents shouldn't panic, but be cautious. Fox's Lauren Martinez has the latest from the hospital.
The medical director for the Children's Hospital said they've been able to meet the needs as far as medical equipment, but they are very busy.
We're going crazy. It's very busy. We can barely keep a bed open before the next one comes in.
On Wednesday, the Nevada Hospital Association said a rise of RSV cases has led to a shortage of hospital cribs and pediatric beds. Dr. Vora said UMC Children's Hospital is not experiencing a shortage of actual beds, just some room.
We're able to handle what we have. We do overflow sometimes when needed out of the pediatric unit, have the older children go to a different floor. But as yet, we've been able to accommodate pretty well.
She said nurses and doctors are working overtime.
So this is almost the way the adults were affected during COVID time. This is now with RSV and the other respiratory viruses. That's how pediatrics is now affected.
Dr. Vora said if you're sick this holiday season, stay away from children. She's seeing patients 3 years old and younger in the ICU.
When you hug your little kids, make sure if you're coming in from outside, change your clothes, wash your hands. If you have a cold or a cough, stay away from the little ones, especially the younger babies.
3, 2, 1, light it up!
First responders sounded their alarms and waved neon glow lights during the annual Lights of Love event. Some of UMC's youngest and sickest patients got to see they're not alone this holiday season. Dr. Vora said they're trying to isolate patients more and restrict the amount of visitors to prevent further spreading. Reporting in front of UMC Children's Hospital, Lauren Martinez, Fox 5 News Local, Las Vegas.
Dr. Vora says UMC is not experiencing a shortage of oxygen or RSV tests.